Managed care plans are also known as Medicare Advantage or Medicare Part C. In recent years, these plans have become more popular. Hi there, my name is Sarah, and I'm here today with iHealthBrokers to discuss managed care plans versus original Medicare. So just to let you know, at iHealthBrokers, we are licensed health insurance brokers, so if you have any questions whatsoever, please feel free to send us a message in the comments so that way we can answer your question, and you can always call us at 888-410-0344. There's absolutely no charge for our services. And as always, please make sure to like this video, click that thumbs up so we can get this info out there, and do make sure to subscribe because we release these videos on a weekly basis. Now, if you'd like to connect with us further, you can find us at iHealthBrokers not only here on YouTube, but on Facebook, Twitter, Instagram, and TikTok. Okay, so now we're going to talk about managed care plans versus original Medicare. However, if you do want to learn more about Medicare or health insurance in general, make sure to stay tuned to the end of the video because there will be a playlist dedicated entirely to Medicare. Original Medicare is Part A and Part B. Part A is your hospital insurance, and Part B is your outpatient insurance. Almost all doctors and hospitals accept Medicare. To keep your Medicare active, you'll have to pay a monthly premium. The base monthly premium for Medicare Part B in 2022 is $170.10. Now, it can be more based on your income, and remember, the Part B premium does tend to increase on a yearly basis. Most people actually don't have to pay for Medicare Part A, but if you do have to pay for Medicare Part A, then your monthly premium could be up to $499. Additionally, there are deductibles and coinsurance that you should be aware of. So, for Medicare Part B, the deductible is $233. You'll have to meet this once per year, and then you'll be responsible for coinsurance. You'll be charged 20% of the Medicare-approved amount when you visit doctors and specialists. For Part A, there's also a deductible to be aware of. The deductible for Medicare Part A in 2022 is $1,556. This is applied per benefit period, or you can think of it as per hospitalization, basically. And you may or may not have coinsurance dependent upon your length of stay and whether you're receiving care at a hospital or skilled nursing facility. It goes in chunks of 0 to 30 days and 30 to 60 days. So you could have a coinsurance of $0 or several $100s. Despite the costs that we've just discussed, original Medicare is actually highly affordable for most people and provides truly comprehensive coverage. However, there are additional programs available for those who have lower income or special needs. If you're looking to cover some of these financial gaps, then you may want to look into a Medigap plan, also known as a Medicare supplement plan. Basically, you'll pay an additional monthly premium to help cover coinsurance and deductibles. For example, you may look into Plan G, which is currently the most comprehensive Medigap plan offered to new enrollees. And let's say that your Plan G costs $200 a month. Well, you would pay that in addition to your Medicare Part B. So if your Medicare supplement plan, Plan G, costs $200 and you're paying that base beneficiary premium for Part B, you're looking at about $370. We're going to round here for simplicity's sake. So now if you pay that 12 times a year, we're looking at an annual cost of $4,440. That's basically it for your health care for the year, except that Medicare Part B deductible, which is the only thing that is not covered and cannot be covered by Medicare supplement plans. So you would add an additional $233 to that. So we're looking at roughly $4,670 for the year for your healthcare costs. It doesn't matter how many specialists you see or how many times you would need to be hospitalized in that year. That would be your total healthcare costs for the year. So that's original Medicare in a nutshell. Now let's switch gears and talk about managed care plans. Managed care plans are also known as Medicare Part C and also known as Medicare Advantage. These types of plans must offer at least the same benefits as original Medicare, but many plans offer additional benefits. These would be things like hearing, dental, vision, prescription drug coverage, and more. And these benefits are not offered by original Medicare, nor are they offered by Medigap plans. At face value, this may sound like a great idea, and it may be for you, but it's certainly not for all people. So let's talk about the pros and cons. Managed care plans often offer much lower monthly premiums than original Medicare, plus a Medicare supplement plan. So you can certainly attempt to save money in that way. However, remember, there is no such thing as a free plan. At the very least, they will require you to continue to pay for Medicare Part B. Managed care plans also impose an out-of-pocket maximum, which is not imposed by original Medicare alone. This is very, very important should you incur major medical bills. Very often, these types of plans offer lower copays or lower coinsurance than original Medicare alone. And finally, like I mentioned before, they frequently offer additional benefits not offered by original Medicare or Medicare supplement plans, and these would be things like dental, vision, hearing, prescription drugs, and many more benefits that you would need some type of additional plan if those benefits were important to you. Basically, managed care plans work very similarly to the type of health insurance that you've had in the past. However, there are definitely significant downsides that you need to be aware of as well. For example, although they impose an out-of-pocket maximum, that out-of-pocket maximum resets on a yearly basis. So if you were struggling with a condition that required continual and ongoing care, once you've met your out-of-pocket maximum, once January of the next year comes, you have to once again reach that out-of-pocket maximum. Additionally, because these plans are not standardized, there are yearly changes very often in the benefits offered by these plans, so you need to look at your plan every single year and make sure that it's still offering the benefits that you need. Finally, and perhaps most importantly, if you choose to pursue a managed care plan, you are giving up access to that extremely broad original Medicare network. As I mentioned earlier in the video, almost all doctors and hospitals accept original Medicare. As a side note, if you enroll in a Medigap plan, no matter who your carrier is, if your doctor and hospital accepts original Medicare, they accept your supplement plan. This is not the case with managed care plans. With a managed care plan, you are beholden to a network of doctors and hospitals. And if your doctor or hospital that you're interested in using doesn't accept your plan, then you may be in hot water. In fact, some people have found themselves having to travel significant distances to find doctors and hospitals that are in network. Now, this is not the case with all plans and all people, but it is something to be aware of. If you're interested in learning more about managed care plans, you can check out your available options on Medicare.gov or work with a broker. And if you'd like our help, you can reach us at 888-410-0344. We are licensed nationwide, so no matter where you reside, we can help. And of course, there is no charge for our services. Now, as I mentioned earlier, please make sure to like this video, click that thumbs up, and subscribe as well to stay up to date. If you have any questions, or if you'd like to share your experiences, or if there's anything you feel like we left out of this video, let us know in the comments below. Thank you so much. We'll see you next time. Bye-bye.